Welcome back, everybody. Thank you so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me after her week off from being sick is the lovely Sarah. You look great after having a terrible illness.
Sorry if I cough a little bit.
Are you still infectious?
No.
No. You sound good. I'm sorry you were sick. I'm totally bummed. Yeah.
It was hurtful.
Travis, in the box, you there, buddy?
Hey, I am.
What's going on, man? You have a good week?
I did. I had a really good
Yeah.
week. How about y'all?
It was good. It's busy. Busy New Year is crazy for me, so I'm like bouncing around.
I feel like
busy.
I'm part of the world that is going through like the couple of days after Christmas and then the New Year starting. I feel like
It's like the doldrums or something.
Yeah, like I'm like, I was taking a shower this morning and I was like, what am I doing? Like I was just like,
Are you off work right now?
Yeah,
Oh,
I was
okay.
just like, I was like, I'm like,
Yeah.
when's the last time I took a shower?
Yeah.
Like
I'm totally jealous. Like, when was the last
I didn't even, yeah, like I haven't been wearing makeup. I've just been like sitting on my couch
But you've been
doing
sick,
nothing.
like, or is this just like your normal like holiday
No, I'm a
routine?
super big couch potato, but since I was
You're the person
sick,
who does CrossFit like 24/7 a couch potato.
everything balanced, okay? But yeah, I was sick, and then after Christmas, you know,
I get
you
it.
still
the
kind of
holidays.
chill, veg out.
My wife's been off for a week. I think she was off part of the week last week. She's off this whole week. I'm like so jealous because I took off Christmas and then I took off the day after. But outside of that, I've been working. So yeah.
I kind of worked. I did the wine tour for
That
Denton
sounds
that
like
we
hard
do.
work.
Yeah.
Drinking wine. I wish that was work. All right, so New Year's Eve coming up. Anyone have big plans?
I don't have
Sarah?
anything going on. I'm surprised you're not having a party at your house.
We're going to a party.
Oh, okay.
Yeah, there's a really, really great New Year's Eve party at Monarch here in Dallas.
Oh, that's cool.
We've actually been the last couple years because it's like so good that we just don't know if we can find something better. It is a lot of fun. In fact,
a nice spot.
Jeff and his wife are going with us.
That's fun.
Yeah, so it'll be fun.
Really cool. Yeah.
So-
I keep hearing about like Tower Club New Year's Eve celebrations. Like
Tower Club.
So I think like the Reunion Tower.
Okay.
They have one. And
Yes.
then I don't think it's the Bank.
Which
of
we've
America.
been to that one at
Have
Reunion
you?
Tower before. Yeah, it's years ago. But
Okay. I keep hearing about that one, and I think it's another like high-rise building down there, like maybe.
Well, that's
close
the
to Monarch.
the Monarch one is like on the 50th floor, which
Okay,
is
it might
super
be that
cool because the fireworks they shoot off over Dallas are like kind of right out the window.
Yeah.
It's pretty dope. Plus
That's
the
really
food is like really, really good. So.
I keep hearing about those, but no, I'm just going to a house party, just a regular
That's
family
fun though.
house party.
Hey man, that's good times.
Absolutely.
Good times. Yeah.
Absolutely.
Right on. Well, we got to get reports. Except for Sarah, it'd be
I don't know what I'm doing.
you got to do something.
I'm sure I'll do something.
Yeah, you got to
Absolutely.
do
They'll
something.
probably pop up last minute.
Yeah. I'm sure you can find something. All right, well, let's jump into some segments today. We got some informative entertainment going on today. The first thing I was going to talk about is the breast lift because I had a couple patients recently that came in, and just with talking with patients, sometimes it gives me ideas for segments because they were kind of really confused about what a breast lift actually is. And it is confusing because there's a lot of different types and different levels of complexity that are involved with it. And so I wanted to just kind of clear the air as far as what all this means, and I actually brought some pictures. I try not to bring pictures of like cosmetic stuff because I don't want this like be an ad for my practice, but it is a good representation of like what these can do. So we're going to kind of show those at the end. So yeah, the reasons that breasts can sag. Genetics obviously is a big one. You know, if your mom, your grandmother, aunts, you know, have sagging in the breast, you're more prone to have it. It has to do with structural component of the breast. Size of the breast is another thing. Also, the big one that gets most everybody is kids. You know, pregnancy, as you know, breasts get larger, then they shrink back down, and what happens is your skin gets stretched out. Not only that, the actual structural components, the fibrous part, the Cooper's ligaments in the breast get stretched out, and then everything starts to head south. Also weight gain, weight loss, even if you haven't had kids, like if you gain 50 pounds and you lose it, that's obviously bad for your skin and your breasts as well. And so another question I always get is, can you fix breast sagging on your own? What do you think?
I don't know. I guess if you did a lot of chest exercises, but
You hear that. That's the common one people ask me is if I do a bunch of chest exercises, will that help my breast? And actually the answer is no, because yes, you can build up your chest muscle, right? But the breast sits on top of that, and the breast is going to do what it's going to do.
Yeah.
And you can't realistically make your chest so big to fill up the kind of vacuum of volume that happens when pregnancy occurs. And so unfortunately, once the breast starts sagging, there's really not a lot you can do on your own. You know, unlike if you gain a little bit of weight, you can diet, you can exercise, you can get rid of that. With breast sagging, that's not possible. And so kind of one of the first things that people need to decide if they're thinking about having a breast lift, to figure out exactly what's the right direction that they need to go from a surgical standpoint is, do you want your breast to be bigger or do you not? Because that's the kind of first big junction in the thought process of what does this patient need is, are we going to use a breast implant or are we not? Because the surgeries for those are different, and that's where like a lot of the confusion comes in.
Yeah, that's what I was about to ask.
What's that?
That's what I was about to ask, because some of the girls that I know, since they know that I'm on this show, they've always asked me like about stuff like that, and I'm like,
definitely. You're like, I'm not sure, right? and unfortunately, I see this happen all the time where a patient may not necessarily want to have a larger breast, but they want it to be fuller up top, and they'll go to a surgeon who puts in an implant, which is not always the right answer and oftentimes the wrong answer because it makes them bigger, which they don't really want to be. It does accomplish the goal of, you know, filling up the top part of the breast, but then a lot of times those patients who never wanted an implant originally, 5 years down the road, want their implants out. And
is there like a way you can do like kind of like meet in halfway?
Yeah, I mean there are alternatives to using implants, and that really boils down to, does the patient have enough breast tissue, like their natural breast tissue, to make the volume that they want or not? If the breasts are way down here but there's good volume, a good surgeon can do a breast lift and put them up and make them look like breast implants. Like, and I'm going to show you a picture of what that looks like. So, you know, I think one of the most important things for people who are thinking about having a breast lift is to find a surgeon who really will talk to you and figure out exactly what you're looking for to help you make the right decision. Because believe me, I've seen many patients that really wanted a breast lift and ended up getting implants and were unhappy. So when you're thinking about the two types of breast lifts, they're called skin-only breast lifts. So that's what we do when a patient wants an implant.
Okay.
And the reason for that is the other type of breast lift, which is called a glandular breast lift. In that one, you take away the skin you don't want, and you actually go inside the breast and move the tissue. But that involves cutting the breast tissue itself, which is totally fine to do unless the patient wants an implant, because if they want an implant, then you're dissecting behind the breast, which cuts blood vessels. And if you cut the blood vessels behind the breast and you cut the blood vessels through the breast, then you end up with a dead breast. So you can't do that really more invasive glandular lift when you're talking about implants. So that's kind of the first big differentiation in breast lifts is, are you getting a skin lift, which generally means you're getting an implant with it, or are you doing a glandular lift where you're just moving your own tissue, all right? And the simple answer is always the best answer. If I get a patient who, you know, can just get away with doing a lift without doing implants, then that's what I would rather do. I mean, you know, I'm not sure every surgeon thinks that way. I mean, some people do like to add on procedures. I personally want to do the simplest thing to accomplish the goal. And
Is there more scarring from a lift?
With implants versus without? Yeah, actually, no. The incisions are...
Because my scar is like under here and you can't see it.
You had augmentation, right?
Yeah.
No lift.
No, I don't think so, because I was so young. I was like 19.
Right. Yeah, no,
I don't think I would have needed one.
So to answer your question, if you're doing a glandular lift, which is where you move your own breast tissue, and you're doing a skin-only lift with an implant, the incisions are basically the same.
Okay,
There's not a big difference. But I'm glad you brought up incisions, because the next kind of big decision or thing to know about breast lift is, how does the surgeon do the breast lift? Okay. Because nowadays there are two very distinct and different ways that people do the breast lift in relation to the incisions. And I brought a little graphic, and it's kind of hand-drawn, so forgive the crudeness. So the one on the left is kind of the classic way that's been around forever. I'm talking like almost 100 years. This is called the WISE. It's also called anchor or keyhole pattern breast lift. And you can see that the red line would be the incision. So there's a red line around the areola, there's a drop down incision that goes from the 6 o'clock position to the areola to the base of the breast, and then there's that crescent incision along the very base of the breast. And you can imagine that that looks like an anchor, hence the name anchor pattern. So the one on the right is what I call a short scar, and you see there's an incision around the areola, and then that drop down comes down and it kind of curves to the outside and it stops, and that's all there is. And so when I trained in plastic surgery, they taught me how to do the WISE anchor pattern because that's the most common thing. But then when I went on and did a fellowship specific to cosmetic breast and body surgery, I was taught how to do the short scar. And now that's literally all I do. I will not do the WISE pattern anymore. And I mean, the obvious advantage to the one on the right versus the one on the left is the one on the right's half the incision. I mean, who wouldn't want to have half the incision that they have to have? I mean, less scar is always better. But more importantly than that, and we're going to talk about complications in a minute, the biggest risk of breast lift far and away is healing issues where that big crescent incision meets that vertical part. That's like known for having healing problems. When you do the short scar, it basically eliminates that risk, which is the number one risk of the surgery.
That makes sense.
So less scarring and less complication is a really big reason to opt for a short scar breast lift. And that's whether it be skin only, which you do with an implant, or glandular, where you're only moving your own tissue. And so I really encourage people, if they're thinking about doing a breast lift, absolutely find someone that does the short scar. I would say probably 1 in 5 plastic surgeons do that because they are harder. You have to go train with somebody to learn how to do them. So even though it's better, clearly, not near as many people are doing that as is doing the old way. But you can find people. You find people that are really good at breast surgery, they're probably going to be doing the short scar, and it is absolutely worth finding somebody that does that. So as far as breast surgeries go, the technique of them, when you're doing the skin only lift, really all you're doing is you're eliminating the skin that is the excess, meaning when the breast starts to sag, you have too much skin, and we are able to draw a pattern on the breast that shows where the skin is too much, and we eliminate the skin that we don't want, and we bring everything together to reshape it. And that's where those incisions come from that were shown in that graphic. The same thing when you do a glandular lift, it's exactly the same as far as the skin goes, but also there's another step where you go inside and move the breast tissue. And likewise with a skin lift, there's another step to do the augmentation part, you know. But that's kind of how the technique of the surgery goes. As far as recovery goes, these surgeries actually have really easy recoveries. I mean, they're just not that bad. I mean, they sound invasive where you're cutting skin, cutting breast tissue, or whatever, but
you don't have a foreign object in your body.
Well, you do with the implant.
With a reconstruction, though.
You're talking about like for cancer?
No, I'm talking, I just said the wrong word. For the lift, what you're talking about.
Oh, for the lift, yeah. Well, both of them actually. So whether you do the glandular lift, which is really just one procedure, versus the skin lift and the implant, which is 2, I mean, they're about the same as far as recovery goes. They're really not bad recoveries. I mean, you've had breast surgery. Would you describe your recovery as being significant, or?
I don't know.
I
was so young.
Yeah.
And my mom took care of me after.
Oh, did she? Oh, that's so nice. In general, people say, though, that breast surgeries are pretty easy recoveries. So, like, for my patients, I say, look, if you can take a week off work, take a week off work, but you probably don't need that much time. A lot of people take just a couple of days, 3 days off, and maybe a weekend, and then they're back and good to go. As far as instructions goes with these surgeries, 2 important things, at least for me. I want patients to wear a sports bra all the time for 4 weeks to support everything while it's healing. Also, I don't want them doing any exercise or heavy lifting because that puts them at risk for bleeding or other complications. Those are the 2 big ones, and there's minor restrictions on showering for 24 hours or submerging yourself underwater for a week or 2. But really the instructions are pretty minimal. I mean, the sports bra is a little bit of a commitment, as is not exercising, which people like yourself who exercise a lot. As far as risks of these surgeries, as I said, the biggest risk of a breast lift is the healing issues. That's why absolutely you want to find somebody that does a short scar, because that really cuts down on that. Outside of that, then just the usual risks of surgery like bleeding, infection, numbness, but all those are pretty low.
Yeah.
Cost-wise, cost of these surgeries does vary depending on if you're doing a lift of your own tissue versus the implant, because when you're doing a lift with implants, it's really 2 surgeries. There's the augmentation and lift. So just ballparking this, obviously don't hold me to these numbers. Like ballpark for a lift of just your own breast tissue without an implant, around $6,000 all in. These are cash prices because these are not covered by insurance. If you're doing the both, where it's a lift and an implant, you're probably talking closer to 10, because it is 2 procedures and you have to pay for the implant.
What about if people like don't want an implant? Like, can you do like? One of my friends asked if you can like place fat from
fat grafting. Yeah, that's a great
from
question.
other places
And actually,
in
I
your
hadn't,
body.
I didn't even think about writing that down and talk about it. But that's a great question. So, can you fat graft a breast? The answer is yes. It's not my go-to way to do augmentation of the breast.
Yeah, because I remember, I think we've talked about it like just a little bit before.
I've done some fat grafting to the breast, and really kind of the best use of fat grafting to the breast is if you have a patient who only wants to go up maybe 50 or 100 cc's, because you can't use an implant that small. You know, the implants have to more or less fit the base of your breast. So that means like 200, 225 is kind of the minimum size implant. Well, some people don't want to go up that much. Like say they're already a large C and they just want to go up, you know, a half a cup size. That's where fat grafting can come in, but there are limitations to fat grafting. The fat always does reabsorb to a certain degree.
Yeah, that's what I told her. I was like, there's like some displacement situations.
Reabsorption,
like
is the big one. So we try to overfill it, you know, anticipating that it's going to come down, but then they don't always absorb equally. I mean, the patients I've done it for, it turned out fine. It's just not my first line.
Yeah.
You know, if you want to go bigger, implants are the way to go.
Right.
I mean, they just are. But can you fat graft a breast? The answer is yes.
Okay.
But for a kind of very specific patient population.
Gotcha.
So I do want to show a couple befores and afters. These are from my own practice. Once again, I always kind of hesitate to bring these because I'm not trying to advertise my practice, but they are good representations of what a breast lift can do. So, all right, throw up that first one. Okay, so this is an inter-op picture where I've finished one side and I'm about to do the other. So this was
smiley faces.
This is a skin-only lift. So this is lifting the breast only by removing skin, but then also placing the implant. And this was a pretty small augmentation. She just wanted to be like a large C roughly. So it's like a small, like 275 cc implant. But results are pretty dramatic. I mean, you know, the breast on your right, if you're looking at the picture, her left has a lot of sag to it. It's very deflated. The breast that we've finished the surgery on is very perky and full. And then I have the next one is a complete before and after of that patient, yeah. So, so pretty nice outcome on this patient. You know, I would say that her breasts had, you know, a lot of sag to them. There really was no volume. And we were able to kind of lift them up, reshape them, and then add an implant to kind of fill them out. And she didn't want to go big, and so she's not. But overall, I thought that she got a really nice outcome.
Yeah,
of that.
it's so crazy because you're like, it just, I mean, I don't know what she looks like, but it just like completely makes her look 5 times younger.
Oh yeah, it changes everything. Yeah, for sure. So this next one, this is a glandular lift, and I think I did a really tiny reduction on this one, and not to confuse you by saying, you know, reduction. A lift and a reduction are the same operation, but in the reduction you take out a little bit of tissue as one of the steps. So for all intents and purposes, the operations are the same, and I think I took a tiny bit, but this is mostly a glandular lift, and so this is once again in surgery where I'd finished the right side, her right, but I hadn't started on her left, and you can see like what a big difference that makes. And if you look at that picture, you almost might think that she has an implant, right?
Yeah, that's what I thought.
mean, that breast on the left of the screen, her right, looks full and round like somebody would with an implant, but that's strictly using her own tissue. There's no implant in this patient. And then go on to the next one, Charles, which is complete before and after, yeah. And so, yeah, these patients can get a look of an implant if they have enough of their own breast tissue, which this patient did. And so this is a patient where I would be afraid if she went to someone that she might end up getting implants where she didn't really need them. She can get the result that she wants with her own tissue. So yeah, I mean, these I think are both a good example of what you can do with a breast lift, whether it be with an implant or with their own tissue. Just to kind of recap this topic really briefly. So today we're talking about breast lifts. So breast lifts are one of the most popular plastic surgeries out there. They are very safe surgeries in the right hands. They can be done with just the skin only if you're going to use an implant, or you can just lift the breast with your own tissue and in a skilled surgeon's hand get the look of an implant, but only using your own breast tissue. The recovery for these is pretty easy. The complication rate is overall very low, and especially if you find a surgeon who does a short scar lift, that is very important if you're thinking about having a breast lift. Now, I'd highly encourage that you seek out a surgeon that does those. But overall, these are great procedures with a very high satisfaction rate. So